I'm Sarah McLaughlin, IMPACTAgewell team leader at Mid and East IMPACTAgewell Partnership here in Northern Ireland. We're an older person's charity, and IMPACTAgewell is a community development, integrated care approach involving many to prescribe alternative care together. This model of care is based on the idea of bringing many partners together to work collaboratively to create the best version of care for older people. Since the beginning of the design of this alternative approach to care, our community pharmacies have been a key strategic partner based in the very heart of our communities. Through our unique locality hub design, community pharmacists work alongside GPs, health trust colleagues and our own IMPACTAgewell officers to provide person-centred care to improve the health and well-being for older people with long-term health conditions. Let's take a look at how that works in the real world.
My name is Ellen. I work for a local charity called Mid and East IMPACTAgewell Partnership as an IMPACTAgewell officer. It's all about what keeps them happy, what services that we can help them access to make their life better, to keep them happy and healthy in the community. Really about us taking the time to listen to somebody and what they want themselves, because often that's quite difficult for some of the services to do because they're pressured by time, whereas we have time to go in and sit down and chat, and we chat about anything and everything. Have a laugh. Different things come up that in the course of conversation that normally they wouldn't have a chance to talk about. Things that they wouldn't maybe mention to health services, and we can suggest then ways that maybe they could link into the community. Rose is just a lovely wee lady. I enjoy the business, maybe more than she does as well. She's very welcoming whenever I go out. Great stories to tell. We have a laugh together.
I look forward to Ellen coming. Have we talk with her about what's wrong and what I need?
She has found it very useful. She's had a stoma for over 30 years and didn't even know that there was a stoma nurse, which has improved her situation a lot.
Ellen was able to put me in touch with a stoma nurse, and she came to visit me. She was doing everything I needed.
We realised that there was a need for a support group for people who have been bereaved. We set up a support group locally. We're going out now to visit Leslie as well. He lives on his own and has been so since his wife sadly departed. He's doing his very best to get out and connect with everybody and stay happy and healthy in his house. It's lovely.
I like my garden, but I find it's very hard for one person now the wife's passed away. When she first came, she gave me a folder to flip through, which had several things in. She got someone to come around, a policeman I think it was, come round and fixed a gadget on my phone, and since then it's been like a different world. Every time the phone rings I know that it's not going to be a nuisance. She asked me about do I cook for myself, if not there's a place that can deliver. I was getting out of breath very quick. Exercising, it helps it. Medication helps me breathing as well. I'm glad I've done it, yeah. And then there's things that she knows that I don't know about, and I think it's that exchange of information that I find most useful.
I meet regularly with the GP, the PACT community pharmacy, the social work support services, and we discuss how we can help older people stay fit and well in their own homes.
When we raise the subject with the patient, we would let them know a brief outline of what the scheme might involve and get their permission to make the referral. So that when we know when Ellen, our key worker, is going to get in touch with them, then they'll be expecting the call. There's been a number of patients who have come back and have reported benefits. Our key worker has a wealth of knowledge of local services and has the time to discuss those and try and encourage the clients to get involved.
I do feel privileged that I am in the position to offer this service to our patients. Patients are phoning us up and thanking us for putting us in touch with Ellen and the group. My own mother has participated in the IMPACTAgewell programme herself. Ellen got a handyman in and she put locks and things on her door, so she now feels a lot more secure in her own home.
That was a good day. I feel that we got loads done. It's very satisfying to finish the day and realise that things are working well. The most difficult part of the job is whenever I'm leaving. That's sort of our last visits, and I find that difficult. But the one good thing is that I know that we've connected them into services. I love the fact that we can help somebody connect again with the community, and that it's a very positive kind of a job to do. It's lovely.
This is something that's not a fast fix. If it was embedded in practice and something that was able to be provided, then I think the ongoing benefits would be long-lasting.
I really would encourage any older patients to take part in the IMPACTAgewell because they will get a lot out of it.
I'd say there's absolutely nothing to lose and everything to gain.
My name is Jonathan Lloyd and I'm a Director in PACT, which stands for Primary Care and Community Together. PACT is a social enterprise, community interest company set up to help try to bring community pharmacies together to work in various projects where working together would benefit the community. We organise the community pharmacy aspect of IMPACTAgewell. We organise all the different community pharmacies and support them to deliver within the project.
One of the organisations that I worked very closely with was the Community Development Health Network. They have been chairing the IMPACTAgewell project right from the very beginning. They are the independent chair of IMPACTAgewell, and CDHN, I believe, have been running for possibly 20 years now and have worked with community pharmacy on developing local community groups, working with local community groups, and I suppose that's why MEAP knew the value of the community pharmacy network.
The pharmacists who represent the community pharmacy in the hubs, they attend regular meetings with the other members of the IMPACTAgewell team, the GPs, social prescribers, somebody from the trust, and they will do that on a regular basis. What the community pharmacy does will be looking at all the individuals within that and looking to see whether community pharmacy could offer any support to those older people within the project. So for example, if they need their medication reviewed, they need doorstep boxes, or they need maybe help with delivery or collection of their prescription, the pharmacist will be able to help with that then. So the pharmacists not only who will work in the community, but they also represent all the other community pharmacists within the locality. So for example, if an older person goes to a particular pharmacy, that pharmacist will then represent them within that hub meeting, and then any outcomes from that will be passed on to their regular community pharmacist.
PACT created this opportunity for community pharmacy to organise and transform, to deliver services in a modern, integrated way, a way which was a perfect fit for the IMPACTAgewell model of care. The funding has also allowed us to provide reciprocity to reinvest financially in our community pharmacy partners. PACT took the opportunity to, for the first time, evaluate the effectiveness of the role of community pharmacy, the effectiveness of working within locality hubs, and the effectiveness of delivering community pharmacy services referred via IMPACTAgewell.
In the first year, whenever we were starting to evaluate the IMPACTAgewell project through a social return on investment and a fiscal return on investment, we realised that there was an opportunity here to add value to the evaluation and for us to evaluate our impact within the overall project. And for us to do that there, Mike were the obvious local candidate to help evaluate and give an external expertise of of the value of our services.
And the results of the evaluation were hugely impressive, with PACT's fiscal return on investment showing that for every £1 spent on community pharmacists within the project, they delivered an invest to save return of £5.81, allowing community pharmacy to demonstrate an enhanced delivery of clinical expertise within a new service model developed in collaboration with IMPACTAgewell. The benefits of PACT's involvement in IMPACTAgewell have been multiple, with pharmacists reporting better working relationships across professions and a deeper knowledge of the long-standing assets in their communities.
Our partners within the community holiday sector, including MEAP, have been excellent right throughout the pandemic, right from the very start where they helped us with delivery of prescriptions through volunteers, right through to today where they're still helping us manage pharmacy queues and identifying older people who we can refer into the IMPACTAgewell project. We now look at the older people that come into the pharmacy under a different light. We'll be looking at them now to see whether the project could help them or not. We can identify older people quite easily now because we know them. and we can then refer them into the project. We find as community pharmacy now that we have better relationships with the pharmacies in the area and also with the other members of the healthcare team. We would, because we're meeting regularly with them, we get to know them personally, and barriers are broken down.
What the IMPACTagewell project has done for community pharmacy is demonstrate the value of a particular commissioned service, but it also has demonstrated how we are able to deliver a commissioned service within an integrated model. And if you think of it, multidisciplinary teams are being established right across Northern Ireland in general practice, but what the IMPACTagewell model does bring is a whole network into that multidisciplinary team within general practice. So it actually integrates the community much more effectively into multidisciplinary teams.